In the past week, both a frontline physician and an EMT took their own lives.
The medical director of the Emergency Department of New York, Dr. Lorena Breen, died by suicide.
It broke my heart. This is where it got her to.
Alcohol sales are up, as are stress levels and feelings of depression and hopelessness.
Life before coronavirus was stressful enough to keep crisis and suicide prevention hotlines busy. But now the virus is taking an even bigger toll on our mental health.
We were previously receiving about 100 to 120 calls per day, and last week, every single day, we had over 200 calls per day.
We know that it's important to, yes, take care of ourselves so that we are able to get through this, but that includes our minds, making sure that we're able to cope.
Some people are coping quite well. Others are struggling.
I have struggled with anxiety, depression, and eating disorders. So for me, this is really important right now.
I've struggled with depression and anxiety since I was younger, and I know that during times of isolation, it can get a little bit worse.
These times in particular are both unprecedented and incredibly challenging.
I want to let you know it is okay to not be okay.
We all need to come together to cope with the stress and to prevent a second epidemic of what can happen if we don't address the stress and trauma. We can overcome it. We've got what it takes to get through this.
Clouds can't last forever. They can't and they won't. It's not how the atmosphere works, and it's not how life works.
ABC 7 presents Your Mental Health, a Bay Area conversation.
I'm so glad that you made it to us today. This special edition of ABC 7 News. I'm Reggie Aki along with Kate Larson. Instead of our usual 4 p.m. newscast, we're going to spend an hour engaging experts and you in this ABC 7 Listens virtual town hall. The issue, our mental health. And Kate, we're asking today, how are you? Because even if the answer isn't great, that's what we're diving into.
That's what we're here to talk about, Reggie. Absolutely. This is an important 1-hour virtual town hall airing on TV, on ABC7News.com, YouTube, and Facebook. Over the next hour, we're going to have a frank conversation with an amazing panel of experts and questions, hopefully, from all of you watching us now. Now, all of the issues we talk about when it comes to the pandemic, health, jobs and the economy, the workplace, education, racial inequities, are all taking a toll on our individual and collective mental health. The changes is creating uncertainty that's manifesting as stress, anxiety, and depression.
Take a walk down any street, and every person you see, covered by a mask, distanced from their friends and family, has a story about their struggle with a new mental workload.
I'm tired of worrying.
Katie is concerned about her parents' health.
They're in their 80s, and they're stranded in Florida right now.
The shelter in place has left Ayanna and Rodney without work, with 3 kids at home.
Stressed.
Just trying to keep my head up, really.
People who still have jobs are worried about losing them.
It does concern me if they're going to eventually permanently lay us off.
Students are stressed about virtual learning and how long it will continue.
You're alone, you don't have study groups. I'm a little stressed about the fall and not being able to go back.
Everyone has been experiencing extraordinary amount of stress in this time that's been really unprecedented.
Dr. Lisa Fortuna is chief of psychiatry at Zuckerberg San Francisco General Hospital.
First the viral transmission surge and then the mental health surge. We are getting ready for that in psychiatry.
She's been on the ground after disasters like hurricanes when there's an acute need for psychiatric help, but she says the pandemic is different.
I think the thing that's made this so complicated is the social distancing.
A big factor for healthcare workers on the front line, as well as people isolated at home.
Some days I've had loneliness.
David Inzarella lives in San Lorenzo.
I've had a few anxiety attacks. I've been struggling with it since the shelter in place, not able to see family and friends.
Brandon Rice is an ICU nurse at Kaiser in San Francisco.
How are you doing as a nurse treating really critically ill patients?
Right now, I'm doing okay because of the things that I have engaged in, such as therapy, speaking about my anxiety, being vulnerable.
When family members can't see their loved one because of COVID, how does it make you feel to have to communicate that type of life-critical information to family members over the phone?
Anxiety and stress.
And then there are people whose lives have been upended by the health crisis itself.
We were having a normal life, and then all of a sudden my husband was
in the hospital with a 10% chance of making the night.
Alinka Espinosa's husband was presumed positive and intubated in the COVID ICU at San Francisco General. His family could not visit.
It was really sad because the nurses would just make FaceTime calls, but it's not really the same. He couldn't talk, he couldn't do anything.
Her husband does not have COVID and is now at home with a feeding tube, but because he can't risk a viral infection, Alinka can't work or get outside help, so she's isolating at home to take care of her 3 kids and husband.
I've never in my life felt anxiety or panic attacks until now. It was hard, it's still hard, and we're taking it day by day.
And I do know Alinka, who you just heard from personally. She's so strong, and I'm so impressed by her resilience and the resilience of so many people who I've met and who I've interviewed over the past few months. Even though so many people are in really difficult positions right now, people are also motivated to do what it takes to get better and to feel better. And Reggie, I do know that our panel of experts have some great ideas about how we can all accomplish that.
Yeah, we're definitely going to get to some practical ways that we can all cope right now. Let's introduce our panel. We've put together an impressive group. Zooming in today, we have Dr. Andrew Huberman, Stanford professor and neuroscientist. Dr. Christine Garcia, a family psychologist with the Edgewood Center. Dr. Alok Patel, our good friend, UCSF physician and ABC7 News special correspondent, and Dr. Karen Skoltedi, geriatric psychologist and open house executive director. Thank you all for being here. I want to start by just talking about defining the problem. Kaiser Family Foundation did a survey. They found that just about half of Americans report that coronavirus is harming our mental health. A study that was done by online therapy company Talkspace, it looked at its numbers. It said that they saw a 65% jump in clients needing them. 40% of people saying that their mental health has declined, according to SAP, which interviewed a bunch of people who are still working right now. And so I want to start with Dr. Christine Garcia. You work especially with families and children, and I want to know how you are defining the problem right now.
Well, at Edgewood, we're really defining the problem as quite broadly and as an oncoming tsunami, actually. You know, in the past few months, we've seen a lot of phone calls and a lot of people calling our crisis stabilization unit. This is a unit that's essentially like a psychiatric emergency room, but for children and families, and it's trauma informed. And we really do try to provide a very healing environment for people coming in with all sorts of crises. And we define crises very broadly, meaning that anyone can come in who's experiencing a child in their family that's really not at their best. And we've experienced a lot of calls and contacts about what to do for kids who are struggling under the social distancing that we've had to do with school shutdown and with family members getting sick. And this includes the frontline medical workers who are out there and also getting sick and suffering the psychological impact of treating so many people. So we're really seeing an oncoming onslaught of more kids, families really impacted by COVID because of how great the spread is of the virus, and then what that does to people, including their losing jobs, losing homes, schools being shut down, and teachers not being able to really provide structure for kids that they really rely on. Yeah. And kids just being home with families all day, all night. I think we're all struggling on some level with that.
Yeah, sometimes in very small spaces, depending on where you live. Dr.
That's right.
Dr. Patel, you were actually the first person I even ever had a conversation about coronavirus with in this studio back when this parallel pandemic that we're talking about, the mental health pandemic that is hitting us, wasn't even on our radar. And that is part of the problem. We weren't necessarily preparing for this.
We weren't. And when we were in the studio together, that feels like a generation ago, and it wasn't that long ago. I think this all caught us off guard, but it makes so much sense. We were so focused on the virus itself, the data, the epidemiology, and this has almost turned into the hidden pandemic within the other pandemic. I think everyone else on this panel could agree with that statement. Because one thing that we're really seeing right now is while coronavirus itself doesn't discriminate based on socioeconomic group, your background, your religion, your culture, anything. It'll infect anyone. So will the mental illnesses associated with it as well. You know, we've already talked about the fact that children are isolated. You know, parents are juggling multiple jobs. Some parents are losing their jobs. People themselves are experiencing feelings of loneliness. There's a lot of fear and anxiety out there. And, you know, if I can speak on behalf of my colleagues in hospitals and looking at previous reports from SARS, 9/11, Ebola, and other medical crises, medical personnel are seeing this in a way that's unprecedented. There is a fear of getting sick. There's a fear of losing patients. They're experiencing patient loss at an unprecedented level. And there's almost a moral injury adding to the burnout that all these people in the front line are experiencing when they want to do the best they can for their patients. But because of the volumes they're seeing and lack of protective equipment, they sometimes can't. And we're seeing that take a huge toll. We already saw a couple suicides. I'm hearing a lot more reports out there, not only in America, but all over the world, of frontline providers experiencing the mental toll here. And it is something that we need to absolutely be proactive about and not just reactive, so that in 3 months from now, we're not talking about this and saying that we missed anything.
Dr. Huberman, I know that you talk about having compassion, but in a very specific way. You talk about the emotional contagion that is happening in our homes right now. Tell me a little bit about what that means.
Yeah, so I'm not a clinician. I'm a laboratory scientist, and we study the stress response, but also how people can move through stress and actually, suppress it when they need to suppress it, accept it when they need to accept it, and leverage it to be more functional. And one thing that we know, based on really good science from many laboratories, is that we need to think not just about the stress response of the individual, but how stress spreads between individuals, families, in small groups and in large groups, and as a population at large. We hear these phrases like calm is contagious, and indeed it is, and stress is contagious, and indeed it can be. But my perspective, really, and the scientific perspective, is to say, well, why is that so? How does that work? And what can we do to promote calm? Because what we know for certain is that while stress is a healthy response that everyone is going to experience from time to time, that we always make the best decisions, including decisions about mental health, from a place of calm. And I think that right now there is this heightened sense of destabilization and stress, and in addition to that, fear, which comes with uncertainty. And we really need to think not just how we're behaving and acting, but how we're impacting others. And sometimes that can compound the problem. When we realize that we're stressed and we're spreading stress, that creates a kind of heightened what I call meta stress. And so today, I know we're looking forward to also, as a group, discussing some of the things that we can do as individuals, what we can do in communication with our children, other loved ones, and in general as a society right now, because this is an extremely important problem.
Right, and we will get to some of the specific ways that you hopefully will calm our nerves a little bit as we move through this conversation. And I want to quickly, before we go to break, talk to Dr. Scoltetti. So your organization works with the senior population, and we have been very concerned about the isolation they're facing.
Yeah, so Open House is an organization who serves LGBTQ seniors, and they experience a lot of the same issues that other seniors experience, but often at a heightened level, particularly around the word isolation. So this is something anyone in senior services is thinking about all the time, because we have seniors experiencing isolation and feeling invisible from their community, even going into this crisis. So in some ways, this isn't new, but it's a new level and a new intensity to a problem that existed before. There's a lot of good research showing that loneliness is actually a stronger predictor of mortality than a lot of physical health conditions that we think about. So LGBTQ seniors are much less likely to have biological children or a biological family, which means their support system is often made up of same-aged peers. And that means everybody's a part of that vulnerable population right now who's most at risk to COVID and being told to stay home. So we've got isolation upon isolation upon isolation risk factors kind of stacking up, and people really struggling to feel connected to their community, which is their family of choice and where they feel loved.
Understood. Okay, so we have all talked to you now about what the problem looks like as we head into this. We're going to seek some solutions in just a moment. We are going to take a short break, but our conversation with the panel will continue. And later, a frank discussion about depression with Good Morning America's Ginger Z and Broadway star Patty Murin.
Thanks, Reggie. And we want you to please join the conversation with us. You are part of this ABC 7 Listens Town Hall 2. You can go to Facebook or YouTube to weigh in and interact with today's virtual town hall. All right, hello. While we are in commercial break on television, we are going to stick with you online. So we've got the panel of experts here and questions coming in from viewers online on Facebook. We've got emails set up. You know, a lot of people are really wondering about anxiety. Obviously, there are a lot of different reasons that people are anxious for. And one question I just got is from an essential worker who says, I work for the city of Willits in Northern California. I will tell you, being an essential service employee at this time is a double-edged sword. I'm thankful for still having a job, but at times am stricken with such guilt because I see so many that are not able to work or open their business. Any of the panelists, I open this up to you. A lot of people are feeling guilt for various reasons in this time. Dr. Huberman, maybe you can weigh in on this. Is something that folks can do to try and cope?
Yeah, well, my lab and my expertise isn't around guilt specifically, but I think what we're going to find today is that almost all forms of mental distress and mental illness, if you will, mental challenges are going to center back to anxiety and fear in some way or another. It's just a feature of so many different aspects of not feeling well, and guilt, I think, is included in that. And so I think really looking at anxiety as something to be addressed, and I might say this again later, but in terms of tools to address that in real time as you're feeling heightened anxiety, but also having tools at hand to relieve some of the chronic buildup of anxiety that's accumulating from day to day, especially in a essential worker or in a first responder. So tools to address anxiety in real time and tools to peel off and reduce the levels of anxiety overall on a daily basis. I think those are going to be the cornerstones of relief for guilt, anxiety, fear, depression, and many of these other things, in addition to some other features as well.
Absolutely. And people are experiencing that anxiety. It's manifesting in different ways, Dr. Huberman. We've just got about 5 more seconds left in this break, and we're going to head back to the TV programming here in about 3 seconds.
We also know that these symptoms persist for years to come, even once quarantine is lifted. The data tell us that when the lives of adults, children, and families are drastically changed for extended lengths of time, for many, anxiety, depression, and stress disorders will become manifest and will persist.
And that was Dr. Ellie McCants-Katz, Assistant Secretary for Mental Health and Substance Abuse, speaking at the White House earlier this week. All right, so this is something interesting that I just read from Dr. Huberman today, and I saw this article that you wrote, Dr. Huberman, with a Navy SEAL, and you were comparing the experience of all of us going through this COVID-19 experience with being stuck in a very small submarine and what Navy SEALs go through, the trauma that they actually experience by being in that small, sometimes seemingly hopeless experience. Can you tell me about how those folks get over it?
Sure. So my co-author on that article was a gentleman by the name of Pat Dossett, who spent 9 years in the SEAL teams. He's a close friend and colleague of mine. I do some work with the special operations community, but that's separate from the work with Pat. But nonetheless, you know, those communities became of interest to me in my lab for the following reason. They deal with high stress, high consequence, high risk situations with a high degree of uncertainty. And really a distinguishing feature that I think people need to understand is that there's no real clear boundary between anxiety, stress, fear, and trauma. But what we know is that as there's more uncertainty, anxiety and stress starts to transition into fear. And when we're uncertain about how often fears are going to occur or surface in us, then it starts to transition into what we might call trauma or PTSD. In that article, we highlighted 3 things that special operations folks do in order to move through environments of high stress, high consequence, that are really life or death with a lot of uncertainty. The first one is what's called moving the horizon. it seems a little counterintuitive, but the ability to focus on a goal that's very close in and within reach, it could seem almost trivial, like making a cup of coffee or saying good morning to somebody that you work with or a spouse. Setting a small goal that's actionable and that you can complete, and really putting as much of your focus and attention on that as possible, we believe absorbs a certain amount of the brain's capacity for a need to focus, and can relieve some of the anxiety simply by setting tangible, actionable goals that move you through your day. This is critical, especially in this time of quarantines, and we don't know what's coming next, of course. And so even as we move out of our homes a little bit more in the weeks to come, setting these horizons can be very important. This isn't just something that special operations do. People, surgeons do this, lots of first responders do this, but we can all learn something from what these impressive communities do in terms of moving the horizon. We all have control over these things. The other one that we talked about was, and that these communities do, which is a little bit counterintuitive, is that when you're feeling stressed, to really focus on the needs of somebody else. You know, we think we got to take care of ourselves first, put our oxygen mask on first, so to speak. And that is true. If you're in a heightened state of stress or panic, you know, you need to deal with that first. However, oftentimes our anxiety comes from the fact that the brain can focus internally, it can focus externally, or on both. And sometimes focusing externally and on the needs of others, or even just doing things without being asked. There's a saying actually in the SEAL team community where they say, act, don't ask. And they mean that in a positive way, of course, where you just do something for somebody in order to assist the group. And then it's sort of a rising tide raises all boats kind of phenomenon. And then the last thing that we described in there was this phenomenon of, you know, when there's uncertainty and you're setting these horizons and you don't know what's coming next, oftentimes it can be very useful to just reward those small steps internally. We don't have time to get into it, but there's a whole reward system, chemical systems in the brain like dopamine. We've heard about these in terms of reaching big goals and how they go awry in addiction and things like that. But the dopamine system is really designed to keep us on path to goals as much as it is given to us when we achieve goals. So in this time, what I can reasonably say, and and I think my friends in the special operations community would agree, would be set small, tangible goals throughout your day. It doesn't matter how meaningless or small they seem. Reward yourself for those just internally. Tell yourself you're doing a good job. This is not positive self-talk in the traditional sense, because you're not linking it to some bigger aspiration.
It's just
you're
for
just
that moment.
Focusing on being functional.
Yeah, I like that. And that reminds me I need to buy some gummy bears on the way home because that's the way I reward myself. Okay, what are you seeing online? What are people saying?
Well, we're getting a lot of great questions, and thank you all so much for chiming in. One of the things that I'm noticing a pattern about is people worried about other people's bad behavior. So I'd like to direct this question to Dr. Scoltetti. A lot of this is coming from older people who are vulnerable. They're 70 plus. They go out with their masks. They social distance properly. This woman says that she was outside, very high risk. Bad encounter recently while out for a walk. Two teenagers intentionally brushed against me, laughed, and took off. I've now developed a little bit of agoraphobia. I had a panic attack when it happened, and now I start to feel the same way whenever I step out the door. What can I do to get past it? I really need these walks for my mental health and physical therapy.
Yeah, I mean, it's been an interesting time because those of us in senior services and who have worked with older people are used to our cities and communities and countries sometimes not thinking about the needs of older adults and sort of unfortunately putting them kind of last on the list. And so there has been some inspiration for me in that we've had a lot more people reaching out, asking to volunteer for our organization, wanting to find a way to help, thinking about seniors in a way that they hadn't been in the beginning. So I've said to everyone, there's no silver linings in pandemics. That's not how they work. But if that was something that could come out of where we started thinking about older people and people in vulnerable populations first and ourselves second, some of the time that can be a really positive change. That said, I know that a lot of people aren't wearing masks and that people are going out and encountering anxiety based on the behavior that they're seeing of other people. So one of the things that I would say is just to think about what conditions are going to be the least stressful if you're already feeling worried about leaving your house. So what times of day are people to be less likely to be out so that you have some distance before you're encountering someone who's engaging in behavior that makes you feel unsafe or uncomfortable. Like I like many people, I'm tired of Zooms at 5 o'clock, but I know that if I go outside my house at 5 o'clock and try and take a walk with my kids, it's constant zigzagging and needing to move quickly. And that's not going to work for a lot of older people. So think about the middle of the day when less people are out. And think about just going a short distance at first. What are 20 feet outside of your house where you can just go, feel like you had a good experience, come back in, so that you start to build some of that good feeling back. Now, the problem is that you've associated that walk with this really negative experience. And I'd get those kids if I could for you, because what a terrible thing to have happen. But go out, have a positive experience, go 20 feet, the next time 40 feet, just so it'll start to have that positive association again as you go out. But again, I think if we can think about seniors and people in vulnerable populations as our first thought, like overall as a society, that's going to be a really positive change for us long term.
All right, thank you so much, Dr. Skoltedi. Very great advice. We are going to go to a quick break. Remember, you are part of this conversation. I'm here monitoring all of your questions, so you can go to Facebook or YouTube to weigh in and interact with this virtual town hall that we're hosting right now with our panel of experts. And if you stick with us online, I'm going to ask the panelists a few more questions right now.
If you or someone you love needs help, please reach out. This is the National Suicide Hotline. And if you need other assistance, we have numbers for additional services scrolling at the bottom of your screen.
All right, we are still online, and I actually want to redirect that conversation to Dr. Garcia. You work with children, a lot of teenagers. Teenagers will be teenagers, so some of this misbehavior is on their end. How do you suggest that parents and families talk to their teens, to their children, about acting appropriately out in public right now?
It's tough. First, I have to say that shout out to all the parents trying to make it work, because it's really hard. And it is developmentally, teenagers are, their brains haven't fully developed so that their judgment is fully there. And so parents have to be the ones to be that part of the brain for the teenagers. However, I think talking with teenagers at various points about how to maintain safety and how to maintain that distance while also allowing some freedoms, because this is the point in their lives when they're just struggling against what comes so naturally to them and is a huge developmental task that they need to accomplish to move forward, which is to try new things out, to be a little messy, or a lot. But, you just need to give them guidelines and parameters. And they may look at you and roll their eyes, walk away, do what teenagers tend to do, but it will sink in there. And if something like that happens, I would suggest having a conversation immediately afterwards and say, what do you think you could have done better there? And give them the benefit of the doubt. I would say it probably was not intentional. Teenagers tend to be very self-focused. And so they're just kind of bulls in the china closet, so to speak. And unfortunately, people are all struggling with this social distancing. And I think work in that way and see what happens, and give them a break and give yourself a break.
Dr. Garcia, thank you so much. I apologize about cutting in.
Sure.
We are going to go back to TV in just a few seconds here, and we'll get back to this conversation.
You're watching Your Mental Health, a Bay Area conversation.
For the people who are struggling, make sure you're opening up and talking about it. I think there was, for a few weeks or, I'd say a handful of weeks, I just tried to fight it myself, and it got me to a pretty scary situation. When we're opening up like this and showing our vulnerability, I guess showing a sign of vulnerability, I think that's difficult. And that's one of the hardest things I've ever gone through. And I can't say it enough that there are probably thousands, millions of people that are experiencing the same exact thing that I'm going through. So I think if they see people like myself or people like Kevin Love or people, Bieber, all of these people have opened up and talked about struggles that they go through.
And that is Olympic gold medalist Michael Phelps being really honest about depression during quarantine and the bigger issue of mental health in sports. Celebrities, they are just like us. Seeing people like Michael talk about their struggles with mental health can go a long way in making it feel okay to not feel okay. You're about to meet two more great examples of high-profile people who have been very candid about the battle that goes on in their heads. First, my friend and ABC chief meteorologist Ginger Z on Good Morning America every day in front of millions of people. The same week she got that gig, she checked into a mental hospital because of her related lifelong battle with depression. And then Patty Murin, a star on Broadway, recently Anna in Frozen the Musical. She revealed her struggle with anxiety by saying that even Disney princesses are terrified sometimes. Both of you had COVID-19 symptoms. Mm-hmm. Both of you have had a history of depression symptoms as well. And on top of that, Patty Murin is pregnant. I mean, Patty, at some point you must have thought, what else could happen to my body?
Honestly, she's going to be a superhero when she comes out. It was the ultimate test in like the one day at a time, one, body chill at a time. You just get through it. And it's like, looking back, I'm like, whew, that was a thing.
And Ginger, mentally, physically, obviously it was tough. I know that you said, you were grateful that you didn't have more lung issues for you, your kids, and your husband, but mentally it also must have been a challenge.
I think there was so much going on mentally. I wish I could tell you, Patty, that the stress would have been different or less if you already had the little girl. But unfortunately, when you have the kids, then the worry multiplies by a bazillion. And the anxiety I'm not an anxious person. I'm depressive. That's what I've been for, decades. But the world is anxious right now. And so when you pair the anxiety of uncertainty going forward with everything, with the uncertainty with a virus that nobody knows enough about, but you likely have, and your children have, and you're watching it unfold in front of you, and nobody knows what's next. My palms are sweating thinking about how nervous I was.
But another thing that Ginger, you talk about is just by saying the feelings, saying I am depressed today or having a bad day, that is a healing point for you.
The anxiety of all of us feeling trapped right now in uncertainty, even if we're in a safe space, and this is where the different boats in the same storm thing comes along. I'm never going to say that I'm having the exact same experience that you are. But what I do know is what I've learned in my past, because I've been in some rocky boats and I've been in some really bad places mentally, that I can take those things and use them, the tools. And the first and most important tool is being honest. So I can't tell you in the last 4 weeks, 5 weeks, how many times I've said to my husband, kind of in jest, I'm like, hey, who wants to have a bottle of wine and sit on the deck and do nothing for the rest of the day? And it's like 9:30 in the morning. And it's funny, but there's truth in my funny, I want to run away. I need help. I can't do the rest of my day. I overstacked it. I overdid it. And it's all building up. So the moment I say that, we start talking about, now, why am I saying that? And that's one of the habits that I used to do. And if I were in my mid-20s, that's how I escaped. And so what am I trying to escape? And then once you have that conversation, you put it out there in the light. And for me, the depression and the darkness that some days I wake up with, especially lately, starts to get dimmer and or start to push it away.
Ginger wrote a book and really put it all out there. And Patty wrote a tweet. But I'm saying that both of those things are so important. But Patty, really, so many people saw your tweet when you were playing Anna in Frozen. And one day you just said, can't do it today. And here's why. And that made such a difference, I think, in so many people's lives. Did you feel that?
I did. I didn't expect it to, it was just sort of like a post, I think. I just, because, like as a performer, it's a really hard schedule, and it was a hard show, and it was a lot of pressure. And I was like, and you feel guilty calling out. You truly feel guilty calling out when you have to. But I was like, I cannot do this and this is why. And just the response was really, it was immediate and it was incredible. I got so many letters at the theater and stuff, and I saved them all. I put them in like scrapbooks and binders just to be like, so I could look and be like, I have so many allies out there. There's so many people out there that feel like me. And so it was just as important for me, I think, to get that response, to be like, oh, wow, this is a community. That it's a club that we never asked to be a part of. That's what I call it. I remember turning to my husband Colin and being like, I think I found my platform. And I was like, that's it. That's it.
And both ladies say that their husbands have been a huge source of support, and that is a primary way that they are getting through this. Of course, Kate, not everyone has a family to support them, and we are concerned about people who are alone right now. It's a real thing.
And that's a lot of the questions that I'm getting. People who are isolated, they don't feel like they're having any contact from their friends or family. Maybe they're not getting that phone call that they so need. So I'd love to ask our panel of experts, what can people do if they are alone, if they aren't getting that outside stimulation and contact they need? How can they do something at home to be calm, to ease their anxiety and stress? Dr. Patel, maybe you can answer.
So I think you're tapping on one of the missing resources right now. When we talk about resources, we often talk about physical resources, seeing a specialist, but this is a social, personal resource. And I think it's a two-way street. So people at home who are lonely need to know that there is help available if they really are in trouble, they want to reach out to somebody. But also it's up to other people as well to know that they should be reaching out. Even something as simple as a text message, a Zoom call, just a simple check-in can go a long way. I got to go back to the very beginning of the hour when Reggie mentioned, how are you doing? And really making sure people ask that question. When you say something like, how are you doing? You might actually hear a response, I'm fine, or I'm good. But there's a new movement now to say, how are you doing really? To make sure people know that you're actually in tune with how they're doing and we're checking in on each other. So I don't think it's up to people individually just to be looking out for their own loneliness. Sure, they need to know that people care about them, but it's up to everyone else to really just pay a keen eye out there, to look to see if there's anyone they can reach out to. And there's some organizations I've heard of who are trying to create, these atmospheres for people who might be isolated, to know that there's a place where you can contact an organization, you might be able to get paired with somebody. And as always, Zoom game nights are doing wonders for people right now, so continue those.
I love that. I love the how are you doing really. I'm stealing that and I'm using that in my daily life. Dr.
Make sure really is italicized though.
Okay. Thank you. Thank you. I would do that.
I can add a.
Yes, please.
Sorry.
Go ahead.
I was just going to say I can add a little bit to that. I think that one of the things Open House did as an organization was, as soon as we went into shelter in place, we actually started proactively calling every LGBTQ senior who had walked through our door, which is about 3,500 people a year. Because one of the things that I find that's true for me, but is true for a lot of folks I know, is we are terrible at asking for help, and we wait till the moment of crisis when things have gotten really, really bad before we reach out. So we proactively started calling people to say, I'm here, I'm connected to you, I'm going to keep checking in. And the first round of calls, that first week of shelter in place, only about 20% of the people said, definitely call me back next week. A week later, same calls go out. A week later, it was above 60% saying, I definitely want you to call me back again. So just to add to the point of, it's not just on us to ask for help, it's about us as a community thinking about each other, proactively reach out. And when the person says, yeah, I'm fine, people are often talking about their basic needs, right? Food, huge issues for seniors, safety, that you've got to go a little bit further sometimes to get people to talk about how they're doing underneath. But I think that proactivity is great. And we do, for LGBTQ seniors, Open House is set up where we can get you a volunteer calling every day or staff calling. And I know that the city's volunteer matching system is also doing a lot where that's a really great volunteer opportunity where we're doing calls out to each other to connect. And,
I really like that you're doing that.
Authentic connection.
Yes.
Sorry, go ahead.
because we have longer to talk to people, so we should use that time.
Right.
Dr. Garcia,
right. Absolutely.
I want to talk to you about parents right now, because I was just talking to a mom that I know in the East Bay, and she's worried about summer because right now her high school age kids are busy-ish with school, Zoom school, but that's going to disappear real soon, and then she doesn't know what happens.
That's right. That's right. I think everyone who is a parent is terrified a little bit of what they're going to do once both shelter in place gets lifted a little bit. And so it's great because people can go back to their jobs. But then what do you do? Because kids are not going to have their regular camps. What I can say is there are going to be other camps that are opening up virtually. And there's lots of free courses and things like that that's going to be opened up for children that I'm seeing out there. Another thing to think about is I know that it's not great for parents to encourage screen time. However, I think screen time during shelter in place, during a time of social distancing, if it's a good diet of screens, meaning something that engages kids with other kids, connects them with others, whether it's a class, a group chat, games, they need that connection. And if this is the way they can do it, I would say encourage it. So definitely monitor your kids' screen time, but sit with them, connect with them about what they're doing and what apps they're looking at, what video games they're doing. You may not be interested in it, but you should know about it. And then see what you can do to encourage the ones that are positive and encouraging resiliency, because that's something we really need to focus on with our community during this time.
Look, Dr. Garcia, I am not being facetious when I say this. I think that Animal Crossing is saving lives. I really do. It's a simple, gentle game, and the consequences are so low.
Yeah,
Right?
Simple things, changing the horizon, just like Dr. Huberman said.
Yes, absolutely. And
you can make friends on Animal Crossing. You can make friends in that game.
You really can.
Yeah, there are positive games out there, truly, and I encourage people to look at them. And there are even ones that are therapy focused and focused on positive behaviors. So they're out there and they exist. So summer is going to be different. It's going to be not the camps that we're used to, but there are things out there for sure.
Okay, our conversation continues. Don't forget, we do have a list of resources at the bottom of your screen if you do need help right now, and we'll have more with our wonderful panel in just a couple of minutes.
And don't forget, we want you to be a part of this conversation. You can go to Facebook or YouTube to weigh in and interact with today's virtual town hall, and we're going to continue this conversation online right now.
Being somebody who's dealt with my share of mental health struggles, specifically anxiety and depression, I know this can be an extremely tough time to navigate.
And we want to make sure that we're keeping our mental health one of our absolute top priorities.
I think that it's really important to try and keep yourself surrounded by people who mean something to you.
If you're a parent or a teen who's struggling through this crisis, please know that you're not alone.
All right, we're continuing this conversation online, and panelists, I'd like to get to two topics quickly if we can. One is alcohol. People joke a lot about drinking more. We do know that alcohol sales have gone up, but when does it cross over to a problem? When do you need to try and figure out a way to check yourself and slow down on the drinking or whatever substance you might be taking? The other question I have is grieving. People have lost loved ones, whether it's through COVID or some other disease or illness, and they can't get together for funerals and grieve in the way that we typically do in this society. So Dr. Patel or Dr. Garcia, maybe you can touch on the alcohol question first.
I think one thing, when it comes to substance, we know that substance abuse is on the rise right now, and people need to be realistic. If you think you have a problem, you should have at least addressed it, had a little bit more self-awareness about what's happening. Also, pay attention to the amount you're consuming alcohol before and after this pandemic. And then realize the fact that, alcohol or other substances are going to mess with your ability to center yourself mentally. They're going to affect your ability to get adequate sleep. And, we know that things like sleep and actually your total body nutrition are all making a big difference in the overall play of your mental health. And so I think people should be a little bit aware of the fact that these things are going to compile on top of each other and are going to lead to more anxiety, possibly depression, insomnia, and other things that are not going to play well in the long run. So if anyone has any questions out there at all or any concerns about their alcohol consumption or other substance, I would strongly, strongly urge them to at least reach out to one of the many services out there. There's nothing to be ashamed about. There's no stigma. There shouldn't be. There shouldn't be anything you should feel less about. You should just simply just get the conversation going.
Well, and Dr. Garcia, we've just got about 30
right.
seconds left in this break. What
Sure.
about young people? Are you seeing an increase in substance abuse?
You know, we see a little bit, but I think that definitely it's a problem across the board. I
10
think
seconds.
as people are just stuck at home and not able to do other things. For kids, we haven't seen as great an increase, I would say, as maybe in the adult population.
Dr. Garcia, I have to pause there. We're going to go to TV.
Sure.
We'll pick this conversation.
Becoming a mental health advocate stemmed from the trauma and loss I experienced after my dad died by suicide. There's certainly a collective trauma that stems from everything that's going on. And I would like to think that maybe for some, we can find opportunities for post-traumatic growth.
That was Zach Williams, son of the late Robin Williams. I had a great conversation with him this week about what he calls parallel pandemics, the viral one and, of course, the mental health surge that we've been talking about today. You can see our full story on our website, abc7news.com. And, you know, the mental health surge is certainly showing. There's been a huge increase in calls to mental health hotlines and requests for counseling service since the pandemic began. UCSF's Langley Porter Psychiatric Hospital reports that compared to last year, this March and April, adult visits are up 11% and child and adolescent visits are up 42%. Dr. Patel and Dr. Garcia, I'm curious if you're seeing these same patterns within your practices and also how telehealth has changed how you treat patients. I've even heard from some doctors that it's helping more people get services because it's easy to pick up a phone.
That's right. I think it depends who you're talking about, and you know, there's certainly a digital divide. So Edgewood Center serves a large population of San Francisco and San Mateo counties, and depending on whether there's access to digital, it definitely has been useful for a lot of families who are hesitant to come in. It decreases some stigma. Some teens really like it because it's on a device. And we've been able to shift our services over to telehealth in some ways quite successfully, but in others, it's been a little bit more difficult due to access. In terms of what we're seeing a lot more serious cases. Certainly, we have residential facilities and we have our crisis stabilization unit. And in those areas, the kids that we see coming in have a lot more serious problems with suicidal ideation, suicide attempts, cutting, running away, on top of multiple traumas that they've experienced. And this will include homelessness due to job loss, due to COVID, and also family experiencing domestic violence, which has increased because of the shelter in place. And we imagine we're going to see even more as this continues and the social distancing persists, even if shelter in place is lifted, because a lot of the usual places where kids typically are seen as needing services, like schools where teachers notice certain things and they have sports, those have been taken away. They're just home. And so they're not able to reach out as much. So we're going to see, I think, a lot more serious cases, a lot more serious numbers of people needing help, including families.
Well, and Dr. Skoltedi, that we can talk about seniors in that same respect. Is there a digital divide if these folks need to get on Zoom or whatever telehealth video conference to communicate with whether it's their mental health provider or a primary care provider about, a regular illness that they're dealing with?
Yeah, absolutely. So there's three things that lead to the digital divide. One is you may not have equipment that lets you do fun things like ABC, Zoom, like we're doing right now. It's great that you're showing on TV as well. The second is even if you have a device, you may not have regular or great Wi-Fi And the third is, even if you've got both of those things, your skills to be able to connect to whatever platform we're asking you to access care or to access entertainment or to access connection with other people may not be there. So we had people in the very beginning who didn't have phones, who were just going from senior center to senior center to be fed, and we couldn't even call them to sort of get connected. So the digital divide is so real for seniors. I really am encouraging for us to think about getting Wi-Fi on affordable senior housing buildings, because seniors are going to stay in place a lot longer than other folks, and we need to really step up and help with the technology. That's another great volunteer thing you can do if you're younger, is talk to a senior and help them figure out Zoom or one of these platforms. But it's a huge challenge. It's part of the reason we're actually doing a live drag show in the courtyard of our LGBTQ welcoming affordable housing buildings tomorrow.
Yes.
Because we know that there are people who are up there who have had zero contact, don't have technology, and they're going to look out those windows and see drag queens in the courtyard, safely done, socially distanced, masked, appropriate. We cannot let technology stop. We cannot let lack of technology stop us from connecting. We won't.
I want feather boas and I want clack fans out. So I'm looking forward to seeing that.
You can come on over.
I just may. Dr. Huberman, if you had a message for people at home right now who may be experiencing symptoms that they have never felt in their life, they've never been diagnosed, they've never been to a therapist, but they want a couple of things to kind of practice now because they're feeling overwhelmed or they're feeling depressed, what is the message that you send to them via your research?
Yeah, so there are several what I would call foundational practices that we should all be doing inside or outside of this current COVID-19 situation on a daily basis. And fortunately, they're cost-free and they are powerful in having outsized positive effects given how little time they take. The first one that's absolutely crucial is to get some light, ideally sunlight, in your eyes in the early part of the day. Okay, you don't want to stare directly at the sun. You know, if it's ever painful or you need to blink, that's too bright. I think most people will be logical about this. Getting light in your eyes early in the day sets in motion a whole set of biological cascades related to the immune system, the brain and nervous system, all these things. It times the release of hormones at the appropriate times of day and night. It actually sets a timer on when you're going to feel sleepy and be able to sleep that night. It improves the quality and depth of sleep. It just has a huge number of positive effects. You can do this through a window. You can just take off your sunglasses, or ideally you would step outside, provided you can do that with safe social distancing in place. That would be number one. The second one is the inverse of that. There are good data now out of the chronobiology unit at the National Institutes of Mental Health that show that bright light exposure, not just blue light and not just screens, although blue light and screens are included, but bright light exposure between the hours of 11 p.m. and 4 a.m. on your local schedule. When you're looking at that consistently or seeing that consistently, Netflix in the middle of the night, looking at the news in the middle of the night.
That's bad.
My apologies. That's bad. In fact, it sets in motion a circuit in the brain that suppresses the release of dopamine.
Okay, I'm gonna have to just wrap it real quick. We'll get back to this in a second, but those are really good tips. Want to remind you to take action. Log onto our website, abc7news.com/takeaction. We have links to resources on mental health, coronavirus, and other issues you may be dealing with, and we will be back.
Hi, I'm Sarah Michelle Geller, and I'm partnering with Child Mind Institute to talk about my mental health during this challenging time. This is definitely the most anxiety and uncertainty that I've ever experienced.
I'm reaching out to family and friends to stay socially connected while we are physically distancing.
And what I do in times like this, I take lots of walks.
Something I really like to do when I'm struggling with anxiety is a brain dump. What I do is I just write down anything that I'm worried about. I just write and write and write.
Just do whatever you need to do to stay safe and to keep yourself calm during this unprecedented time.
All right, and we're going to pick up this conversation. Dr. Huberman, I want to get back to you. 30 seconds, a few more tips on how people can improve their mental health right now.
Sure. So morning sunlight exposure, 2 to 10 minutes or even less if you don't have time for that. Ideally, you stand outside, get some light in your eyes early in the day. Very important. Avoiding bright light exposure of all kinds between 11 p.m. and 4 a.m. unless your job or safety requires it. Once in a while, fine. Turning on the bathroom light, fine. But try and keep the lights dim. Stay off screens from 11 p.m. to 4 a.m. It has a very detrimental effect on a whole number of different biological processes, including mood and depression. This is well established now. The other thing is, I strongly believe that people should have real-time tools for controlling their stress. So we'll talk about this in detail, but because we don't have much time, the quickest way that we're aware of to physiologically calm yourself quickly is to inhale twice through your nose and exhale long through your mouth. It activates a set of neurons in the brainstem that control sighing and actually trigger a connection between the brain and body to activate the calming response. You might need to repeat it a few times. Sometimes your heart rate is the last thing to come down to baseline, but that simple activity or procedure rather of breathing twice through your nose and out through your mouth is the best way we know to calm fast. A lot of people say they can't breathe through their nose. I would say just do it anyway. You actually, unless you have a total occlusion, it's very likely that you can breathe through your nose. If you have to breathe through your mouth, you could do it through your mouth.
I have some sinus issues, and I'm working on it right now, and it's still possible, Dr. Huberman. I think that's a great reminder, is to just breathe. My mom always says, take a deep breath and count to 3. She said that since I was a little kid, and it always sticks with me during a moment of stress. Dr. Skoltedi, really quickly, I want to get back to my earlier question about grieving. 20 seconds. How can people grieve from a distance?
Yeah, it's so hard because it's about connecting. But one of the things I'll say is grief doesn't have a smooth, you move through it like this. That's always been true, but that's particularly true now. So give yourself time, space, and distance, and know that it's going to look more like this. You're going to go back and forth through stages, and give yourself that compassion and grace, and figure out one person who you can really talk to and open up to. Don't feel like you have to find 20. Figure out one person that you feel like you can actually really talk about what's going on.
That's great advice from all of you. Thank you so much. Back to the show.
This went too fast. We want to thank our panel of experts for taking time out of their busy schedules today to talk with us and with you about mental health. This is only the beginning of an important conversation, but one we think is worth having. Kate?
And Reggie, final thoughts in the spirit of being vulnerable and trying to shake off stigma. I've struggled with depression in the past and even anxiety more recently over a situation that was completely out of my control. I did seek out counseling and am still working through some lingering stress. I find that focusing on the day ahead and what needs to get done in that moment, maybe it's putting together a great story for the news or a fun activity with my daughter, is a productive way to at least focus my anxious energy. Elizabeth Wurtzel wrote in Prozac Nation, that is all I want in life, for this pain to seem purposeful. And I know a lot of people are working, listening to this panel, and are hopeful that we can all move forward in a productive way.
And thank you for sharing that, Kate. And my final thought today, a few years ago, my new doctor at the time asked me a series of standard questions. How often did I feel stressed? Did I ever feel a lack of hope? My answers came fast, and so did his. New patient Reginald Akey needs help. I put it off. Unaddressed issues went from bubbling up to exploding. The help that I was once hearing was a recommendation was now actually an emergency. I'm telling you this because if you are feeling that bubbling up of emotions right now, please tell someone. Maybe it's a friend, or maybe it's a doctor, or maybe it's both. You deserve, we deserve to be mentally healthy. I want to thank you for watching today. I want you to take care of yourselves, and I want you to, like Dr. Patel said, ask each other, how are you doing today? Really? ABC 7 News at 5 is coming up next.